Hey there, fellow grad students. Test coming up on PTSD? Well, I have 11 practice questions for you to get you ready for your upcoming test. Ready? Let's learn psych fast. Question 1. Which of the following is not required for a diagnosis of PTSD? A. Re-experiencing traumatic event. B. Emotional numbing and detachment. Or C. Hypervigilance and chronic arousal. Or D. Uncontrollable worrying. The answer is persistent and uncontrollable worrying. In DSM-5, it lists 4 types of symptoms for PTSD, which is intrusions, avoidance, negative alterations in mood and cognition, and alterations in arousal or reactivity. Question 2. You're speaking to a female who is a survivor of an intimate partner violence. The woman relates has been told that he has characteristics of an antisocial personality disorder. The woman also informs you that her husband has an extensive criminal record. You interpret this information and suspect that the woman's husband would most likely demonstrate which behavior? A. A risk for moderate to severe violence with people both within and outside his family. B. Intermittent remorse for the violence and abuse that he commits. C. Symptoms of depression along with harboring feelings of inadequacy. Or D. Purposefully remains socially isolated from people other than those in his family. The answer is A. The patient has a risk for moderate to severe violence with people both within and outside of his family. Question 3. A 34-year-old man confides in you that he experienced childhood sexual abuse. Which of the following features is not a characteristic feature of PTSD? Is it A. Hyperarousal, B. Emotional numbing, C. Nightmares, or D. Loss of inhibitions? The answer is D. Loss of inhibitions. In PTSD, they can develop in people of any age following any traumatic event, for example, a major disaster or childhood sexual abuse. It encompasses what became known as shell shock following the First World War. One of the DSM-5 diagnostic criteria is the symptoms have to be present for more than 1 month. Question 4. A patient has presented complaint of nightmares and flashbacks following a traumatic car accident. They feel as though they're on the edge whenever they are near a road and become anxious if they have to go on a journey. What duration should symptoms typically be present before the diagnosis can be made? Is it A. 7 days, B. 1 month, C. 2 weeks, or D. 8 weeks? The answer is 1 month. For a diagnosis of PTSD, symptoms should be present for at least 1 month. If symptoms are present for less than a month, a period of watchful waiting is advised. This will help to establish whether these symptoms are transient or constitute a formal diagnosis of PTSD. Waiting longer to make a diagnosis would not be appropriate given that this patient's level of distress and the impact that these symptoms are having on his life. Question 5. A 29-year-old fireman presents following a recent traumatic incident where a child died in a house fire. He describes recurrent nightmares and flashbacks which have been present for the past 3 months. A diagnosis of PTSD is suspected. What is the most appropriate first-line treatment? Is it A. Arrange for a CT of the head to exclude any organic cause, B. Cognitive behavioral therapy or eye movement desensitization and reprocessing therapy, C. CBT or graded exposure therapy, or D. CBT or psychodynamic therapy? The answer is B. CBT or EMDR. So with this, following any traumatic event, single session interventions, often referred to as debriefing, are not recommended. Watchful waiting may be used for mild symptoms that are less than 4 weeks. When it's military personnel, they have access to treatment provided by the armed forces. Trauma-focused CBT or EMDR therapy may be used in more severe cases. Drug treatments for PTSD should not be used as a routine first-line treatment for adults. If drug treatment is used, then venlafaxine or an SSRI such as sertraline should be tried. In severe cases, risperidone might be used. Question 6. You see a prison officer who has recently been assaulted at work by an inmate. For around 2 weeks since the event, her sleep has been poor and she's been irritable. She experiences frequent flashbacks of the event and has been off work since as a result. She is reluctant to discuss the event, but has been brought by her partner, who is concerned as she is becoming increasingly distant. You suspect she has PTSD. What is the most likely treatment to be initiated at this stage? Is it A, watchful waiting, B, start an SSRI, C, commence an antipsychotic, D, EMDR, E, trauma-focused CBT? The answer is A, watchful waiting. Drug treatments for PTSD should not be routinely used first line. Your role in the initial management of a person with symptoms of PTSD is to determine the need for emergency physical or mental health assessment and to coordinate care. For those with mild symptoms, a watchful waiting approach can be taken for up to 4 weeks. This is appropriate for this patient. Question 7. True or false? According to the estimates, PTSD has a lifelong prevalence as high as 30% among Vietnam veterans. True or false? The answer is true. 17% of veterans experience PTSD returned from Iraq and Afghanistan. Vietnam veterans have been found to have a 20 to 30% lifetime prevalence of combat-related PTSD. Since PTSD is a chronic condition, appearing in some cases many years after return, it is not surprising that even from World War II, veterans' persistence of PTSD after 45 years is estimated at least 12%. Question 8. Which of the drugs are effective for treatment of PTSD? Is it SSRIs, mood stabilizers, atypical antipsychotics, or antiadrenergic drugs? The answer is an SSRI. Drug therapy, particularly SSRIs, is effective. Mood stabilizers and atypical antipsychotics only show scant evidence for the effectiveness of these treatments in PTSD. Antiadrenergic drugs such as clonidine, guanfacine, or prazosin may help relieve hyperarousal symptoms in patients with acute stress disorder, but supportive data is preliminary at this stage. Question 9. Which of the following is not a way to which children manifest PTSD symptoms differently than adults? A. Children tend to express their distress through aches, pains, and other somatic symptoms. B. Children try to act more like adults or their adult siblings in order to deal with the trauma. C. Children tend to generalize their anxiety to more situations. Or D. Children tend to play out the trauma repetitively with dolls or toys. The answer is B. Children try to act more like adults or their older siblings in order to deal with the trauma. So these children may not have flashbacks or problems remembering parts of trauma the way adults with PTSD often do. Children, though, might put the events of the trauma in the wrong order. They might also think there were signs that the trauma was going to happen. Question 10. Which of the following appears to help PTSD sufferers avoid alcohol abuse? A. TCAs, B. benzos, C. SSRIs, or D. barbiturates? The answer is C. SSRIs. So the current evidence base for PTSD pharmacology is the strongest for the SSRIs, like sertraline, paroxetine, and fluoxetine, as well as the SNRIs, venlafaxine. Currently, only sertraline and paroxetine are FDA approved for PTSD. All right, last question. Question 11. Some people with PTSD have damage to the, what part of the brain? hypothalamus, frontal lobes, hippocampus, or the adrenal cortex? The answer is C, the hippocampus. How trauma affects the brain, the hippocampus may be physically affected. Studies have shown that in people suffering from PTSD, the volume of their hippocampus may be smaller than others. Mainly, how trauma affects the brain, the hippocampus will affect the ability to recall some memories for trauma survivors. All right, all done. Thanks so much for staying with us. I really, really hope you find this to be helpful and that you're succeeding in your studies. But if you do find this helpful, please share it with a classmate, like and subscribe. Thanks.